Hello everyone, I'm Dr. Lee Howard. I'm a board certified surgeon and I'm the medical director and owner at Cellular Healing. And today we have with us Leslie, and Leslie is getting her 6th treatment, I believe, right? Is that right? With ozone therapy, and we are treating her for Epstein-Barr virus, which is the virus that a lot of us get, and it causes mono. And in some people it actually causes periodic problems with sleep, and they feel really tired, they don't have a lot of energy, and so Leslie sought us out, and we're using ozone to help her with that problem. Ozone is an interesting drug, if you will. It's basically oxygen. So when we give ozone to the body, and there's a lot of different ways that we can do that, the ozone actually goes in to help the body with decreasing inflammation and helping supply oxygen to the tissues. And so after about 6 treatments, I think Leslie's had a pretty good improvement, a pretty drastic improvement in her overall feeling and how well she's doing. So we're going to go ahead and get started today. We're doing a hyperbaric ozone treatment, which means that, or it's also called a 10-pass treatment. And so we're going to be using this IV to pull the blood from Leslie's arm up into this collection bottle. The collection bottle will then house the blood while the ozone and the oxygen are mixing with it before we reinfuse the blood back into the body. And we will do that for 10 times or 10 different passes. So now, as you can see, we've reached about 220 cc's, and now what we're going to do is we're going to start to pump in the ozone and the oxygen into the bottle. Yes, pumping ozone into this chamber once it fills all the way up. And now we've got ozone and oxygen going into this bottle, but this is mostly ozone in here, and it's going to oxygenate and ozonate this amount of blood that's in here. And then we're going to start to reinfuse that. So I want to talk to you about the different ways that ozone can be used. There's a lot of different types of treatments where we can use ozone to heal the body and correct inflammation and really make the body healthier. So the most common way now that we use ozone is through a direct intravenous route, where we actually just through a syringe inject ozone into the bloodstream through a small IV in a vein in your arm. And then the other way is through the 10-pass method. That gives you so much more ozone, and it actually allows me to treat more of the whole body rather than just doing a simple IV-based injection. The other ways that we can use ozone is through the stethoscope. So a lot of times if we have chronic sinusitis or chronic otitis, inflammation and infection in the ears, or if we're working with toddlers or younger people who don't tolerate needles so well, we can give them ozone through a stethoscope, and it has a tremendous amount of benefit. The other way that we can use ozone is through a limb bag. So if we have a wound on an arm or a leg, we can actually put a plastic bag around the arm or the leg and infuse ozone into that bag so that the wound can be exposed to the ozone and help the tissues heal quicker. One of the final ways that we can use ozone is through a rectal or vaginal insufflation, where we insert a small catheter into the rectum or the vagina, and we infuse ozone into the body through those cavities. And that is extremely effective, particularly if we're dealing with pathology in those areas. For people who have inflammatory bowel disease like Crohn's or ulcerative colitis, doing rectal insufflations of ozone can be extremely helpful in controlling their symptoms. So ozone has a lot of good characteristics about it, including its safety profile. Now, I've done several hundred of these types of treatments, and thankfully we've never had any issues with patients having adverse reactions or having problems. The most common thing that we hear from patients is that their vein or their arm is a little sore where the needle stick was. But that usually goes away within about 2 or 3 days, and most people would not stop getting the treatments just because they had a little bit of soreness at the site where the IV was. Other than that, the ozone is very well tolerated, and usually if we're doing ozone therapy, we're doing it for a long-term purpose. This is not typically something that if you get just once is going to give you a huge benefit. But if you continue to get it over a period of time, then it's going to pay dividends for you. Think about it like working out. If you go work out at the gym one day, you're probably not going to see a change in your bicep size. But it's the steady that wins the race. It's going to the gym 2 or 3 times a week over the course of months that is going to yield the benefit that you most likely want. And it's the same with ozone treatment. So it's the long game that wins with ozone, and it's the steady progression of doing ozone on a regular basis that's going to help achieve your health goals.